Thanks for staying with us. Now to health matters. A malaria grant from the Global Fund is expected to help increase the drive for malaria elimination in Nigeria. The project has already started in communities within 13 Global Fund malaria states across the country. Kemi Balogun tells us more.
Malaria still remains a global public health problem, despite numerous interventions and advocacies to curb it. Nigeria has the highest burden out of the 15 countries that account for 80% of the global malaria deaths in 2016. In Nigeria, malaria illnesses occur all through the year, and 97% of Nigeria's population are at risk of the infection, while children under the age of 5 and pregnant women are most vulnerable. Although malaria can be devastating to both the population and economy, it is preventable, treatable, and curable. The civil society in malaria control, immunization, and nutrition is implementing the grants for malaria for a 3-year period between 2018 and 2020 in 13 states.
So for the first time, the civil society and the partners are now working to bring solutions to challenges. So what we are doing is not classic MIE, monitoring and evaluation, where we find out what is wrong, and we report it. We are finding out what is wrong, we are reporting to the agencies who are supposed to work on it, and all of us are working together to solve it.
What we want to do is to ensure that everybody join hands together in ensuring that we eliminate malaria, let there be zero death from malaria.
A significant effect of the malaria burden is the high level of poverty in countries with high burdens, which makes it devastating to the economy.
We saw the last report of World Bank saying that the poverty level is, very, very unacceptably high in Nigeria. So malaria is it reduces productivity, and it also results in poverty. So they are inextricably related, that if you have malaria, you're going to be less productive, and therefore you're likely to be poor.
The civil society interventions have so far been improving on the synergy between communities and healthcare facilities within the states and local government areas. Despite several interventions and government policies, there are still a lot of hurdles to cross when it comes to the elimination of malaria completely by the year 2030. Kemi Balogun, TVC.